What is the first thing that comes to your mind if someone tells you that there's a patient who has had a wound or an ulcer in his or her chin area for the past 6 months? Well, to have an ulcer or a wound in any part of the body is not very alarming. The thing that is more concerning about the previous statement is the duration the patient has had that wound or an ulcer. The first thing that comes into your mind is that, is it something related to malignancy stuff? So that was what my thought process was. But then we just don't come to a conclusion based on the chief complaint only, right? So there was a case where a patient was referred saying that she had a wound on her lower right chin area for the past 6 months and it was not healing. On clinical examination, this was the picture of the wound. So there's a lesion in the chin area on the right side, and that requires further investigation. So on clinical examination, you can see that all of the teeth in the mandible requires some form of treatment. There are root stump in the right quadrant. These are the premolars. This is the canine. This is the lateral incisor. So what we did next was we took an x-ray of this area. We wanted to rule out the relation of the wound and the teeth. So this is an x-ray. As you can see, the periapical region of this root apex, you can see radiolucencies here suggesting periapical abscess. All of these teeth had a chronic asymptomatic periapical abscess. And then we thought it could be a sinus tract that's opening extraorally. So we decided to do something called sinus tracing that was previously discussed in the video. So sinus tracing is really an important diagnostic tool. As you can see that a 25 number GP was inserted from the opening in this wound, and it did go all the way in. Again, a radiograph was taken. You can see this white part. This is what the GP is, and it traced all the way back to the apex of the mandibular right canine. When there was a sinus tract, I was hoping it was from the premolar, but then again I was proven wrong by the sinus tracing with the help of the gutta percha. So they traced all the way back to the mandibular right canine, implying that the sinus tract originated from the apex of this tooth. This video is actually after the sinus tracing was done, so the GP is taken out so you can appreciate it. So sinus tracing is just a reverse of this video. So you just insert a GP inside and take an x-ray. So the diagnosis of this case was an extraoral sinus that originated from the odontogenic infection of mandibular canine, a chronic periapical abscess. The patient opted for extraction of mandibular canine, and this is a clinical picture 7 days after extraction of mandibular canine. As you can see, the sinus opening has closed. The wound is healing really nicely, and intraorally, this is how it looks. The wound is healing nicely, and in this visit, the root stump and the premolar and molar regions were all extracted, and the patient is recalled after 1 month. So the moral of this story is that don't just come into conclusion hearing what the patient says. Examine the case properly, do necessary diagnostic tests, and never forget sinus tracing. Thank you.